Hello, I am Dr. Pratibha Sethi, practicing gastroenterologist at Bangalore. Today, I would like to discuss about gallbladder stones, commonly called as gallstones. So, what are these gallstones? These stones are found in the gallbladder, and these gallbladder stones are very different from the usual kidney stones, which is usually confused by our patients. The gallbladder stones are formed due to a diseased gallbladder and due to the thickening of the bile. So, what are the most common causes for gallstones? The most common causes are high cholesterol levels and also obesity. And we have another mnemonic where we consider who are very high risk for gallstones. That is a fat, a fertile female of 40. So all these are risks for gallstones. So what happens basically in gallstones is the inner lining of the gallbladder gets diseased and it thickens the bile to much more than the usual, and it slowly starts forming sand and later crystals and later stones. So what is the consequence of gallstones? Usually gallstones are most of the times asymptomatic. That means patient will not know, but somehow while they do a scan or they get treated for some other problem, it is incidentally detected. So in incidentally detected gallstones, we usually do not do anything, as the gallstones can be asymptomatic for a long time. So, but what are the symptoms of gallstones? These patients usually get pain after eating food, which starts around half an hour to 1 hour after food and lasts for 1 or 2 hours, and it comes down on its own. This is one type of presentation. Another type is they have very squeezing type of pain on and off after intake of food, and that can come down on its own or it may need medications. So these are the symptomatic patients whom we need to give treatment. So the treatment of gallbladder stones are divided into medical treatment and probably endoscopic treatment or surgical treatment. So in medical treatment, the smaller stones, very small stones which are detected, can be treated by giving medicines for around 3 to 6 months duration. But the drawback of this treatment is once we stop the medicines, the gallstones will come back. So the next treatment is surgical treatment, where the gallbladder itself is removed, and then there is no risk of stone formation. What happens if we do not do the treatment for these patients? Sometimes these gallbladder stones slip into the bile duct, which is very near to the pancreas and which joins with the pancreatic duct and comes into the intestine. These small gallstones which just slip into the bile duct, they can slip into the intestine and they may not cause any pain. But some gallstones just go and block the bile duct or the pancreatic duct. So when they block the bile duct, these patients develop severe pain, they have jaundice, and they may develop severe bile infection, which is life-threatening. And if it blocks the pancreatic duct, the patients will develop severe pain abdomen, which is called pancreatitis, pain, vomiting, and abdominal bloating. This is also a life-threatening situation. So we do not want the patients to go through this problem. So the main reason for gallbladder formation is due to, again, bad lifestyle, lots of fatty food intake. So patients should be careful about their food intake, and if they have any symptoms of gallbladder stones, they should visit the doctor immediately and take the treatment accordingly.